I'm Dr. Robert Wilcox, founder and director of the Plastic and Cosmetic Surgery Center of Texas. We built this state licensed facility in the year 2000 and moved in January of 2000, right after Y2K, if you recall. So we've had a very good operation here with a fully state licensed surgery center. It's a freestanding center, so it's very convenient for the patients and their families. I was born and raised in Dallas, Texas, went to high school here, went to Texas A&M University, graduated magna cum laude there, and then attended the University of Texas Southwestern Medical School in Dallas from 1980 to 1984. I then moved to Florida and attended the University of Florida Health Science Center in Jacksonville for 5 years of general surgery training before returning back to Parkland and Southwestern for 2 years of plastic and cosmetic surgery center residency. Afterwards, I stayed on for a year of hand surgery and microsurgery fellowship and have been board certified in all three specialties: general surgery, plastic surgery, and hand surgery. I believe this extra training gives me expertise to operate all over the body and extensive education in all the surgical principles necessary to get good results. I've wanted to be a plastic surgeon since I was 16. We had a neighbor who was a plastic surgeon, and I would join my father, who's a podiatrist, to watch Dr. Dunton perform surgery. I like to play golf. I should be better as much time as I've invested in it. But I like all sports, like to water ski, snow ski, like to travel, cook, read extensively on all sorts of topics. Mostly history. That's my real love, reading historical books. People think, oh, you have to be a specialist if you're just going to do face or just going to do breast. Well, if you only train for 2 or 3 years, that probably would be true, but with 8 years of training, I'm expert in all of those areas, and I enjoy operating all parts of the body. As a matter of fact, one of the most interesting things about plastic surgery is we're still truly the most wide-ranging general surgeons there are, because we truly operate from, or as we say, the skin and all its contents. There's a lot of misunderstanding on the part of the lay public as far as what the standards are in medicine. People will say, oh, I'm a board-certified cosmetic surgeon. Well, there's really no such thing, because when we're talking about board certification, the main body is the American Board of Medical Specialties, and they designate mainstream medicine specialties and recognition of those specialties. And by that, they apply standards of training as well as written and oral examinations to ensure competency in those. In the state of Texas, any physician who is MD after his name can do anything they wish in their office, regardless of their training or lack thereof. So you have people who think they've learned how to do breast augmentation on a weekend course, but they're totally unprepared to deal with any complications arising from that. There is a reason why when you want to do cosmetic surgery in a hospital, you have to meet the certain criteria of training and such, and so most of these non-plastic surgeons can't get privileges to be done in a hospital, but it's still the Wild West in their own offices. You can have an emergency room doctor doing cosmetic surgery, a pediatrician, anyone. So those standards are important to protect the public as well. Shortcuts are not unacceptable to me. Shortcuts mean you are lazy. You want to take the easy route. And I think when a patient understands what it takes to do things properly, then they'll respect that too. People who go abandon the residency and specialty they trained in order to start doing cosmetic surgery, you have to ask what the motivation is, and it's quite clear what that is.